Well, thank you for joining us, Dr. Erica Mallery-Blythe.
It's a real pleasure to be here. Thank you so much for inviting me.
Dr. Erica Mallery-Blythe is the founder of the Physicians Health Initiative for Radiation and Environment, also called FIRE. It's a United Kingdom trained, she's a United Kingdom trained medical doctor with a decade of experience with hospital medicine in various disciplines in multiple countries. And she helped coordinate the 2020 consensus statement of United Kingdom and international medical scientific experts and practitioners on the health effects of non-ionizing radiation. And that has been signed on to by organizations representing over 3,500 doctors. Emergency trauma medicine is her area of expertise. And in training for this specialty, she has a broad base of medical experience, including surgery, anesthesiology, obstetrics, pediatrics, and intensive care, both neonatal and adult. She's worked in emergency hospital rooms, led trauma teams, taught on trauma medicine courses throughout the United Kingdom and abroad, and was selected to instruct doctors on teaching with medicine for advanced trauma and life support. In 2008, she began researching the biological effects of non-ionizing radiation, and this included copious literature appraisal, conducting her own research via medical histories, medical examinations, and testing of those with electromagnetic sensitivities. She's provided expert witness statements regarding electromagnetic hypersensitivity and been invited to discuss the public health concerns of radiation exposure at the highest political level, both in the United Kingdom and in Europe. She also has provided support for schools and parents who require advice to better protect the health of children, and information and advice for doctors and their patients. She formally transitioned from clinical medicine to full-time research in 2015 and continues to advise where appropriate and necessary. And I know you have presented at the latest 2021 medical conference in the United States that was virtual, and also in 2019, where I was just delighted to meet you in person, where you presented. And I cannot thank you enough for joining us today to tell you about your organization, your research, and what is happening in the United Kingdom.
Thank you so much. And it's really a pleasure to be part of this group and to link with the Environmental Health Trust, which I think we all have an enormous debt of gratitude to. You guys have led the way in this subject matter for so many years now. And when I put FIRE together, it was really wonderful to have Professor Deborah Davis on board with us as well. So we have a really great team of physicians and scientists that represent countries diversely, and who all share information together to try to stay at the cutting edge of this really rapidly evolving, completely new area of medicine. So in terms of my declarations, I'm the founder of FIRE. I'm a medical advisor to ORSO, which is has a fantastic database for those of you who want to find the original scientific articles and read them for yourselves. I'm a member of the International Guidelines on Non-Ionizing Radiation, or ICNIRP, which I'll tell you a bit more about later on, and a medical advisor for ESUK, which is a UK electrosensitivity advocacy group. And to just be clear to those of you who are new to this subject, my group FIRE is absolutely not alone. You're aware now of the Environmental Health Trust's very important work, and all of these other organisations all over the world, and many more, where we have very similar initiatives that I'm going to describe. 4 very important ones that I have focused on with my work with FIRE. I'm going to run through one by one. And I'm going to do this fairly quickly because I think what will be a most interesting part of this morning is some question and answer and a bit of dialogue with those of you who've joined. So, but to just give you an idea of what we've been doing with FIRE, we've covered 4 particular areas. One is looking at 5G, since it's such a new aspect of this issue. Safe Schools Initiative was a really important core action that I became involved in right at the beginning of this. I think it's incredibly important. EHS medical awareness initiatives, and SAFER, which stands for Safe Areas for EMR Refuge, which kind of ties many of these different issues all together. So to just give you a snapshot of the 5G 5 Facts campaign that we launched over here, this was, we just wanted to bring some really basic information to the public forum, because there's a great deal of misinformation here in the UK. There still is. And I put together this trifold leaflet that anyone can download and print from our website, which is firemedical.org, by the way. So there's quite a lot of different free resources on there, and we're updating new ones all the time. This was a quick fact leaflet, which we based, we put together with 5 main points. We pointed out that radio frequency exposures can be linked to some very serious health effects. They're linked to issues such as cancer, nervous system disruption, reproductive impairment, and so many more. And that children are more vulnerable to many of these effects also. We pointed out that animals and wildlife are affected, and this has become increasingly important. It was interesting to me that when I first started lecturing on this topic around a decade ago, nobody really wanted to hear about that. It was very important to me, and I wanted to talk about environmental effects, but actually people were very focused on what is this doing to human health? What do we need to know to protect ourselves? And over the years, both fortunately and unfortunately in a way, people have become more and more tuned in to the very important wildlife effects that we must take seriously. I say unfortunately because it's obviously a product of the crisis that world is facing. But so now we can really talk about this issue. It's very important to note that these groups are also affected, and that's critical right now. The consent issue, number 4, the fact that people haven't given informed consent, I think is really very much at the heart of this issue, in that some of you may have heard of something called the Nuremberg Code, and this was a code of ethics drawn up and agreed upon by many nations that we pledged really after some very dark times in humanity, where there was human experimentation in wartime. There was some very important ethics that were praised and agreed upon where this was wrong. The practices of doing anything experimental on humans without them understanding and giving full informed consent is not reasonable. And you could argue that many of these different communications frequency deployments have never really achieved that important informed consent from the public. They've never been made properly aware of the science of this issue and then been allowed to consent or withhold consent and therefore not be exposed. So that's a sort of ethical side to this, moving away from the science for a moment. And then safety limits, which have been hotly debated for many years. But what most people don't realize is that these limits were really designed to protect against a very specific type of biological damage, that is thermal or heating effects. They weren't designed to protect against low intensity, what we call non-thermal effects. And these have been documented in many hundreds of papers now. And so we have very, very robust evidence that these are real, they're happening, and that they can lead to serious biological damage. So you can see that I've focused on each of those points there, and then there are some tips on the back of this leaflet for ways in which you can take practical action to try and move forward. Now moving into the Safe Schools initiative, this is in some ways quite separate to that, but in some ways heavily linked, in that we're now going to start to see types of these higher frequencies, potentially 5G frequencies used in the newer routers that will be deployed in classrooms. But a really important message to move away from 5G for a moment is that myself and I'd say most of the experts that I've been working with for the last decade are really united in agreeing that existing infrastructure itself is also not safe. It's not simply that we're about to do something completely different, which is that's the big dangerous thing, and everything else is fine. 5G rests upon technology. Most of it, in fact, is going to be existing frequencies and waveforms, and those have been used in schools for a long time now, and could be leading to quite a number of different negative health outcomes. So how do we go about trying to inform? And by the way, this very short talk that I'm giving with some slides here isn't designed to focus on the science so much as what we're doing. And there are lots of other lectures out there. There's some from myself freely available on YouTube to explain the science behind this. But what's important really is the education side. It's purely giving people the facts at this point. And that's how these discussions need to begin and evolve. So what we do with FIRE is we offer lectures to any schools that request them. And the way that I usually advise to proceed is that you give a lecture, first of all, for governors and head teachers. And if they're in agreement that this is an important topic that they want to share with their school, then we move on to give a lecture to all of the staff body and then parents and pupils. And I've gone through this process with some schools, and it can be immensely successful in that if you have a governing body who are really receptive to this and want to take a proactive, progressive approach to improving health in schools, then giving this information empowers people. They feel happy to move forward. And I found it really heartening how well pupils can receive this, because quite often parents in particular can feel very overwhelmed, and they'll come to me and say, well, it's all very well, I am concerned, but there's just no way that I'm going to get my child to reduce their use of these devices. But a lot of these kids are actually very open to hearing some of the science and considering, you know, that actually maybe they don't need these exposures as much as they thought they did, and just having them think about it in perhaps a more conscientious way. And that's had some very good effects. The next phase after sharing the information and education is advice, practical advice on how you do it. How do you do this? What does it mean? There's a really common misconception that I've been astonished at how pervasive this is, that Wi-Fi means internet, that the two things are interchangeable. And quite often people are horrified at the thought of losing Wi-Fi because they think that means they can no longer use internet at all. Now, this is absolutely not the case. We use hardwired infrastructure to replace Wi-Fi in providing access to the internet. So this would be things like Ethernet cables. And again, you know, for people who feel heavily dependent on their mobile phones, these days there are some fantastic workarounds where you can use things like lightning adapters to hardwire your phone and your smartphone and actually keep it in flight mode. So all of the radiation, the radio frequency radiation is disabled, but you can still do things like WhatsApp or even use Skype to make calls in and out. And of course, surf the internet through this lightning adapter with an Ethernet cable. So there's a great deal that we can do to lower EMF, but retain the functionality if that's what people want. And this has to be individualized. So every school is very different, and some schools can be incredibly easy to do this, and other schools much more difficult. So as an example, we had a state primary school here that had a child come to the school who was exquisitely sensitive. She had EHS, electromagnetic hypersensitivity. So that meant that she got headaches and insomnia and some other health complaints whenever she was exposed to Wi-Fi or phone radiation. And the school took this really seriously. They were fantastic, and they asked me for practical solutions on how this could be worked around. And they went from what was a Wi-Fi system to a fully hardwired system. We were lucky though, this was a small remote primary school, and so there weren't any major radio frequency fields coming from outside the school, which made it really simple. And they did actually continue to occasionally use iPads. They used them with Ethernet cables, or they used them in flight mode where the kids could use them portably at their desks. But the best message, the reason I'm telling you this story is because what I found fantastic about this was after the first few weeks of implementing the changes, I went back to the staff and head teacher and said, right, let's troubleshoot. Tell me all the problems that you've had so that we can work around them and sort them out. And I did expect there to be quite a lot of complaints, just because when you change any infrastructure, that's part of the process, it's normal. And overwhelmingly, I had this really positive response that the staff at the school were really happy about the new system. Now, I think there's a number of reasons for that. Partly, they understood why they were making the change because we'd given a lecture that explained to everyone why it was being done. I think that's so important. And secondly, because they mentioned some things that I hadn't thought about, but actually they had previously had a lot of problems with kids accessing various internet sites through the Wi-Fi that weren't related to education and they weren't too happy with. And that problem had stopped. And they had some other issues as well, that teachers had mobile phones in the classroom. They were often getting texts from family or friends that was very distracting. And they probably thought that that was nice and that they wanted it. But what they found was actually, because all the staff were asked to put their phones in flight mode when they entered the building. And instead, they gave their family and friends the landline number of the school and said, if there's something really important, obviously phone that number. And actually what they found was this relief. They felt focused on teaching, they felt relaxed, they weren't looking to check their phone to make sure that they hadn't missed an important text. And they said that the whole space felt simpler and more relaxing to teach in for both the staff and the pupils. So this was a really great outcome and one that I really hope we can see in more and more schools. On that note, I've put together another little trifold leaflet that will be updating to our website very soon, that just gives a few quick facts again, and points out that children are more vulnerable, and it points out a couple of things that people who might be skeptical or at the very beginning of this journey, I think it's worth asking a couple of questions of schools at the very beginning. And ask them if they've done a risk assessment. I'm not sure how things are in the US on this subject, but here in the UK, schools are supposed to do a risk assessment for any new major change in the structure of the school. And most schools, I'm not surprised to say that most schools haven't done a risk assessment here, but there is a risk assessment available online that's been done by a neuroscientist who's very familiar with this subject. And that's one of the links I've got on this leaflet, actually. And then it's worth asking if the school are insured for health damages. Now, obviously, we don't want to get to that point. We don't want to see any health damages. But in part of the learning journey, I think it's really useful for people to understand that, to my knowledge, I don't think any schools are insured for that kind of outcome. And that's very meaningful. We don't ever want to test that or put it into practice, but insurance companies are not keen to indemnify, and they are risk analysts. That's what they do. So for people who find it hard to get deep into the science and understand all of that, relying on the risk assessments of groups like insurance companies is a perfectly reasonable thing to do. And when a school is not insured against negative health outcomes, I would suggest that's really meaningful. And then I've just put some simple steps here. What do we do? Well, we start with education. Everything starts there, and then opening constructive dialogue. And I've got a little bit here about what to do if you think maybe your child has some symptoms. I'm approached on a really regular basis now. It's quite overwhelming, actually, by parents who are concerned that maybe their children are having symptoms. And the sorts of symptoms that are common are things like headache, sleep disturbance, mood disturbance, sometimes palpitations, heart dysrhythmias. And these can be difficult to pin down because they can be symptoms of other issues as well. But it's really important that if you are concerned, you discuss that with your doctor. And probably important that you also connect your doctor with a good source of information. And there's some on the other side of this leaflet. Here in the UK, FIRE are happy to speak with any medical doctors. In fact, we've also spoken with some abroad where people have asked, and just give them up-to-date peer-reviewed published science about this issue, because most doctors really don't know very much here at all. And I'll move on to the next phase of that with my next few slides. And then this has just got a few facts as well about some of the important work in other countries to try to bring better awareness, and some graphics showing how RF penetrates the brain of children so much more deeply, and some graphics looking at DNA damage also. So moving on, I mentioned that most doctors have no awareness of this issue at all. So this is another initiative that I have underway with FIRE, is medical training. And this takes many different forms. So everything as humble as individual telephone calls to help support doctors with the science. So if a person who thinks they may have symptoms or related disease speaks to their doctor, they can give a contact for FHIR, and we speak to all doctors and give them as much advice as we can, again, often in the form of peer-reviewed papers that we send to them to help them research the issue themselves. Then we give lectures for groups of doctors, and this has been very successful here in the UK. So I first lectured at the British Society for Ecological Medicine in 2014, and sowed the seeds, really, because that was the first, I think, that they'd really got involved with this issue. And then lectured to them again last year, and just had a really amazing turnout and really amazing support. And in fact, they've been heavily involved with the consensus statement that I put together in disseminating that to their membership and visibly supporting it, as so many other environmental doctors groups abroad have done. So this is going to start in the domain. In terms of specialty, this is going to start with environmental and ecological doctors, but I'm hoping this will move quickly to all other specialties. It's very relevant to every single specialty. So everything from cardiologists, pediatricians, neurologists, there's almost no group that can really say it doesn't touch their speciality. Then we have large-scale international conferences, and I want to take the opportunity to say a massive thank you to the group who put together the 2021 EMF medical conference this year, because that was, to my knowledge, one of the largest events that's ever taken in place covering this subject. 4-day conference with extensive lectures covering every facet and angle of this, which I thought was genuinely fantastic. And that is still available as an online course for those who want to download it. And educational courses on EMF health in general. So my group is also working with the Australasian College of Environmental and Nutritional Environmental Medicine, ICNIRP, and we are putting together a really basic course as well, a short introductory course for doctors to give them a grounding in this subject. And then expert witness reports. This is very, very important, and the reason I say that is in medicine, we like to fix people, and it's very frustrating if we can't give them what they need. So even doctors who are familiar enough with this subject to diagnose it often can't prescribe what these people need to get better. What they need is a low EMF environment. And in many cases, that's really inaccessible. And doctors can therefore feel very disempowered and restricted and hopeless sometimes. But I would remind them that actually their testimony is incredibly important to this patient group. And if they have educated themselves, then they can absolutely give a letter. And sometimes for some doctors, they're producing really excellent in-depth reports, which can make all the difference. Those can change their patient's life via a different pathway than they're perhaps used to, but this can help them get accommodated. And EHS, for example, is being recognised as a disability in multiple courtrooms in multiple countries. Here in the UK, we have had it recognised as a disability for a child, and we have had several cases for adults, and some degree of financial support for many of them. So this is rapidly unravelling, and these kinds of important court cases will continue. So in terms of educating doctors, I've lectured at a number of conferences, and these are the kinds of resources I'm trying to put together, is things that I remember from my training, you know, the way in which we like to approach things and structure them. And so just giving simple flowcharts to help doctors think of a strategic way to move through this safely, and considering alternative diagnoses for the symptoms, but making sure that they incorporate lowering EMF in order, because you know, a very important point here is it will do no harm, but it's highly likely to improve general health, even for somebody who actually doesn't have any acute symptoms. I would consider it a good lifestyle change, a bit like, you know, eating more healthily, more fresh fruit and vegetables, for example. And the other tool I've put together that I hope is helpful, it was something I saw missing from clinical assessment of EHS. I've read a lot of papers now published about EHS, and some of them are quite confusing. For example, some recent papers have shown certain biomarkers are elevated in people on blood tests and things like that. But it wasn't 100% of people. There were quite a lot of people with EHS who didn't have changes in these blood markers. And I thought, now that's interesting. Why is that? And there's lots of potential explanations. But one of the explanations that I see is that it depends what stage of EHS you are in as to how likely you are to actually have altered parameters that are physiologically observable. And so I put this staging system together that's incredibly simple. And it basically points out that people start perhaps with mild headaches or the occasional palpitations. They're very mild symptoms. They may or may not discuss them with their doctor. This is actually the most important phase, because this is where we can fully reverse people, in my opinion. This is where if all doctors, if all GPs were aware that this can happen, and the first time their patient comes in and says, oh, you know, I'm being really, I'm finding it really uncomfortable, I'm getting these heart palpitations, or I've just been getting these headaches at work, or if they immediately said, you know what, try this, and started giving them simple ways to lower their EMF exposure, a good number of these people, in my opinion, would immediately have those symptoms disappear and may never have those issues again unless they have higher exposures. When you move to stage 2 and 3, where you have more moderate and then severe symptoms, we can see irreversibility. So a number of these people, whilst they can feel a lot better in a very low EMF environment, when you transfer them back into the high EMF environment, they become unwell again. And this can produce some very severe lifestyle restrictions. There are some people who are so acutely sensitive to these radiation exposures that they can no longer access their job, they can no longer live in the same house. And this produces huge problems and strain, financial as well as social. And 4 is remission. That is where we want everyone to get to as quickly as possible with an appropriate avoidance management plan. So this very quick, easy structure I put out there as a downloadable tool to help doctors keep a record of where their patients are, because over time it can be very difficult to know what kind of progress is being made, and that allows assessment. And then management. Again, this is incredibly simple. I've just put together a structure that I've called the A to H's, because it puts avoiding the fields first, which I think is the key. You know, if you have a toxic exposure, the first thing you do is take away that, and then you look at other ways to improve health as fast as you can. So the rest is about health optimization, with a particular focus on ways to improve physiological changes that may be related to EMF. And I won't go into this in detail. That's in other lectures online. Now, moving forward to the 4th initiative, I've called this the SAFER initiative, standing for Safe Area for Electromagnetic Refuge. And this is actually related to all of the other initiatives that I've just mentioned. This kind of brings them all together in many ways, because we need these safe areas in all settings. We need hospital bays, which are accessible to people with EHS. We need school classrooms. All of them should be low EMF, is the truth, but even just having some areas that are for the kids who have symptoms now, or for parents who are trying to actively withhold consent for exposure. We need to be making these areas in all public spaces, and having residential areas. Again, a large part of my work right now is I'm being regularly contacted by various groups, including planning authorities, who have people they're trying to accommodate who have EHS, and they have no residential places to accommodate these people, and this is creating a proper crisis. We have people camping in woodlands and sleeping in cars, and this leads to a whole load of sequelae that can be as damaging as the physical health effects themselves. And I've put together a bit of a structure on how we can create these zones, both on a micro level, you know, one room in a building, and on a larger scale, like putting together a village, for example. And that move to blue is just showing how at night time, it's very, very important that at night electromagnetic fields go right down to as low as is possible, because that's a period of regeneration for the body that is especially important. And keeping that sleep-wake cycle correct is essential to good EMR health. I've worked in conjunction with this group, ICNIRP, I'm a medical advisor for this group, and we have been putting together some practical guidelines based on the Europa EMF guidelines 2016. So this is a great document which gives some numerical values for exposures for different groups, including especially low exposures for people who are sensitive. And we've translated those into something that's more practically useful, the way you can actually be told which kinds of meters that you can use in what areas and what the main source is and how you can get alternatives. So it's just designed for something like a hospital or a restaurant or a GP surgery to be able to read through and get some ideas, right, this might be causing it and this is how we can fix it. And you'll see here we've got daytime, nighttime and sensitive exposures as per the Europa document. But the important message really about that is just to point out how low we're trying to go for here. We can't reach background natural levels because the whole planet has become so polluted at this point that it's impossible to reach that really, really low level on a small scale. But we are looking for something that's way below the current ICNIRP guidelines that you guys use in the US and we currently are using here in the UK also. And so it points out the common culprits that are causing it and ways that you can substitute those to get a lower output, and some signage which helps people know, right, I'm moving into this kind of zone, I need to turn off my phone, put it in flight mode. And an important question here, because we like to be inclusive these days, it's very important, who needs to be in that zone? And I love this question because when I think through that, I think, well, everybody who doesn't need to be in that zone. And it's an interesting one, and we get back to the whole informed consent, and really the only people who don't need to be in that zone are the people who say, I've read all the science and I'm not worried and I'm a consenting adult and I don't want to be in that zone, I want to be using this kind of wireless radiation. And that presents this in a very different way, where we're perhaps not trying to produce zones that are low EMR, we're producing zones a bit like smoking rooms where people can use Wi-Fi instead. So to bring together all of those initiatives in one simple document, I put together the 2020 consensus statement. Thank you so much, Theodora, for mentioning this at the beginning. This was released last year, but it's still open for signing. So anyone watching this, if you feel impassioned and want to add a signature, that will always be welcome. We have concentrated on getting medical doctors together for this, and when you read through it, it's available on the FIRE website, so firemedical.org, under 2020 consensus statement, and you can sign electronically, but you can read through the document. And the reason I put this together was because I wanted a single source that was very simple, very concise, and had a good number of excellent references, because people need that science. If they want to move forward, quite rightly, they want to read it for themselves, they want to understand it, and then they want to pass it on. So I'm hoping this brings a lot of those different elements that I've just covered together in a document that I hope will be really useful to you. And in it, we point out the problem first of all, and we talk about the fact the guidelines are not protective of some seriously harmful effects. The fact that exposures are unavoidable, even for people who actually aren't consenting to them, and that there are some issues with the current advice, because many of the advisory groups are biased by conflicts of interest. That's become an increasing problem. We saw this in the tobacco industry, we saw it in the pharmaceutical industry, and it's really no surprise that, of course, we're seeing it again with what is perhaps a larger industry than either of those ever were. So what are we asking for? Well, we're asking for new radio frequency emissions to have a moratorium, to not progress down this route any further, and to have a review of guidelines to make them more biologically protective, to protect schools from within and without, to designate low EMR zones for anyone who is acutely unwell and those who just simply do not consent to exposure. Education programs of exactly the sort that are being rapidly rolled out, and like right now with the Environmental Health Trust, and a zero tolerance approach to industrial influences on public health policy, which is a no-brainer, isn't it? I mean, it's so obvious. It kind of astonishes me that we're seeing this again. But and that's what the page looks like where you can sign. And lastly, this is just a quick resource that, again, for those of you who are new to this subject, this is a how-to guide, which you can download, and just gives a really quick, these are the common sources in our home, and these are some of the ways that you can circumvent them to lower your own exposure. Useful actually for doctors to have in their surgeries. That was the primary reason I put it together, is doctors can give this to a person who knows nothing about this subject when they come in complaining of whatever their symptom might be, headache, dizziness, insomnia, and it's worth them giving this a try to see if they feel better. And that's perhaps proof of diagnosis, you know, if that happens. If they only make one change and it's to lower their EMF and their symptoms stop, then you have an excellent diagnostic method there. So these are some points of action for the group, and they very much echo what I just put together. And these are some of our mission statements. But please do feel free to join FIRE. It's free to join. We have members from all over the world, and we will continue each day to do what we can to slowly move towards a healthier future. So I'm very happy to take any questions or discuss anything that you would like to. And thank you so much for listening. Thank you, Theodora.
Thank you so much, Dr. Mallery-Blythe, for sharing all of this. I have been impressed with you since I learned about this issue a decade ago, and just learned from talking to you before we started this webinar that you started way before that. I remember a talk you gave about children where you addressed common myths and facts, and it was one of the best. I think it was like 10 minutes. It was so short, but you captured everything in that short talk. And when we put this up online, I'm going to put some of your other talks up so people can access those, your talks on electromagnetic hypersensitivity, as well as that talk. So I have a lot of questions for you, some technical, some about you. And I wondered, let's start with what brought you to this issue. And then from there, we'll go into children in schools. So what got you interested in this?
Yeah, so it was a complex journey. Whilst I was working in emergency departments, the first I touched on it was actually a friend of a friend who the friend mediated and said to me, this guy has got symptoms that he thinks have been caused by radio base stations, and can you comment, you know, can you give him any advice? He's not getting anything useful from his medical doctors. And I didn't know anything. That's the truth. None of us do. None of us did. We weren't trained in this area. So I immediately got online and I did some research. And I went to all the normal places that I would look to. So I looked at Public Health England, Department of Health, WHO, and all of them pretty unanimously said there's nothing to see here. There's no health concerns. It's impossible for this to cause any health damages. So that was where I first kind of dipped my toes in the water. And I went back to this friend and I said, well, I haven't found anything that would indicate that this should be a source of symptoms. Fortunately, I had some perspective and said I'm not an expert in this area though. So, I'll keenly watch this space, and I really hope your friend finds the solution for what's bothering him. Now, he knew, he was 100% certain what was causing his symptoms. And this was fascinating because that is one of the things that unites a lot of people with EHS. And even the WHO have pointed this out, that these histories are incredibly sincere. They're coming from people all over the world giving the same reports of the same symptoms. Right. But it didn't take long for me to get other people complaining of the same things, to the point where I just thought I have to dive into this a little deeper and experience some symptoms myself. You know, that's the strongest evidence, isn't it? First-hand evidence, and within my family. And so I started reading the source documents, and instead of taking summaries and conclusions from websites that were looking from a broader perspective, I actually went to the source literature and read it more carefully. And then I was frankly astounded. I just thought, oh my goodness, I could see at a glance that there were hundreds of papers. And I started to realize within months that in fact there were thousands that were relevant, that were good quality, and that were reproducing the same kinds of outcomes and concerns. And I was finding the same patterns of injury and the same cell types and the same symptom constellations over and over again in different types of studies. So, you know, this constellation of things like headaches, neurological disturbance, cardiac palpitations from different sources. So from higher end phone users, and then also from Wi-Fi exposures, and also from MRI scans. So there was this, in my own head, I was doing a kind of layman's Bradford Hill. I was doing the causality criteria, trying to work out, is this evidence strong enough? very quickly I could see that it absolutely was. Some of the papers were extremely credible. They're from military groups dating back to the 70s. You'll be aware of this kind of literature, but it was absolutely, it's kind of mind-blowing to anyone who really gets properly immersed in it, how strong the evidence base is. And then there's no going back, really. It's a bit like Alice down the rabbit hole. It's very hard to walk back into the previous job you had when you realised that so many of the cornerstones of your practice are missing a really important area of medicine. So I just carried on moving forward and dedicated my life to this area.
Wow, amazing. And thank you. We're so thankful, and I'm so honored to have you here to talk about all of this. It is an astounding lift that's happening around the world. So going to some technical questions, and could you unshare your screen if you?
Oh, yes.
That would be great. Do you know if parents with electromagnetic sensitivity have a greater chance of their children becoming sensitive themselves? Any research on that?
This is an interesting one, and to my knowledge, it's only anecdotal at this point. I don't think large-scale studies have verified this, but anecdotally, I can tell you that clinicians who are specialising in EHS, who see parents, are reporting a higher incidence in first-degree relatives. Now, there is more than one possible explanation for that, and I'll quickly run through those. So if there was any genetic predisposition, that would obviously explain that. There is some possible indication of that in some literature. There's a paper from DeLuca, maybe 2016. I wouldn't swear to that, but there are some possible predisposing genetic traits. Moving forward, though, if it's exposure related, and we know partly it is, so certainly. The development of EHS is interesting because in my opinion, it can be caused by almost any biological stressor. Mm-hmm. Because it's part of an upregulation in the sensory system that covers not just EMFs, but chemicals usually as well. Yeah. So there are some reports of EHS developing after, for example, a large toxic chemical exposure. But of course, you have to have, for the actual symptomatic trigger, that has to be electromagnetic, or we're not calling it EHS, we would call it a different type of environmental sensitivity. So the maintenance of it has to be electromagnetic for it to be called EHS. But so given that EMF exposures have to be part of that evolution, then of course, if a family has had a large exposure, either to electromagnetic radiation or some other toxic exposure, that could make both the parent and the child more susceptible. So there could also be environmental reasons that we see it. And lastly, of course, there's the issue of understanding and knowledge. And if a parent has EHS, they are far more likely to be open and attentive to the symptoms in their children and notice what's triggering it and what's suppressing it. So there are lots of different factors that could all be at play in seeing this. My suspicion is that far more children are sensitive to these fields than are currently known about, and that we are seeing some epidemics of disease in kids that are rising and do fit with the increasing exposures temporally, or in the same time period. So I think if awareness was better, we would probably be seeing a much larger number of children presenting with that as a feature to their doctors. I hope that answers that. Yeah.
Yes. I have another question from someone going on to continue on electromagnetic sensitivity. What is the ICD-10 code that is relevant? I know about the W90 codes, which are about exposure to non-ionizing radiation, but what codes do doctors use?
There are a few, actually. There's more than one, and I have a couple of slides on this listing them. So what I'll do is I'll send them to you. I'll try and dig them out and send them to you. The ones that I think are most applicable right now are the external causes of external injury, and then injury caused by non-ionizing radiation. And but there are other ways that you can interpret them, and doctors may use slightly different ones depending on the presentation of the specific patient as well. So some are more applicable to some individual circumstances than others. I would like, as with many other doctors, I want to see an individual coding that is actually called electromagnetic hypersensitivity, or there are a few different names for the condition, but something that is slightly more specific. But I think that code is perfectly reasonable to use right now. And the ICD-11, you can go online and have a look at the content for that when it comes. And again, there's a new set of labels in there which I think are equally reasonable to use, because they do describe what's happening, which is essentially injury from electromagnetic non-ionizing radiation exposure.
Thank you. How about Max asked, are there plans to educate practitioners in China, in Asia? Or, any plans to educate doctors in Asia on electromagnetic sensitivity?
That's a great question. And it's interesting that China has much lower safety limits than much of the rest of the world. And in fact, did, I think, an excellent report looking at oxidative stress that they submitted to the WHO. They have some fantastic literature coming from China. But in terms of specific educational programs, the answer is I don't know. And if you would like me to be connected with any medical groups out there that you might think might be open and interested in trying to move some of these educational programs toward their doctors, I'd be very open to that and happy to discuss it.
Great. You know, a few things. So I know that Korea has an agency that actually educates. They have videos where they show how to reduce exposure, especially for children. And as you said, China has lower allowable thresholds for cell tower radiation. And there's a lot of research that we have online at Environmental Health Trust as well. Some of the best research we're seeing right now, because of course in the United States, there's really no funding for it except for some small studies of which we don't even have all the information we need coming out of the National Toxicology Program. And I'm thankful that they're doing it, but we're pretty shut down here in terms of research, funded research by the government, not tied to industry.
Absolutely. And I feel that we've got exactly the same problem here in the UK.
Yeah. Regarding lectures provided to schools, you talked about some of the actions that you're taking. What do you think is the most effective action for people who are listening? Should it be proactive or responsive to requests? Shirley, I'm reading your question, trying to make sure I have it right. Do you recommend offering educational presentations or publicizing? What do you think is the first step, most powerful step for people?
I think it's got to be a gentle approach, because especially for people who've been in this subject for a very long time, they can have gone through a very big journey and an epiphany and a transition which took them a long time to absorb and to respond to. For somebody hearing this for the first time, which oftentimes these schools are, it can be really tough actually, and they might have a lot of very understandable obstacles, and a lot of schools are not receptive at the first meeting. So it is very important how that dialogue is opened and started. So I think this is a great question. The way that I have seen people do it, and I've done it myself personally, is to start with a meeting with the head. If it's a parent, normally it would be a meeting with the head, and to bring some good literature. I think that's essential. To say that you understand that this is contentious and that there's a lot of misinformation, but that here is some evidence that supports your concerns, and could they please read that, and then could you have another meeting later? And I'm actually I'm in the midst of putting together some packages for different settings. So packages of information that would be a nice collection for people to take. The consensus statement, it was kind of designed to try and cover all bases. So it's a good start, and you could take that. It shows, and that they can look up those individual studies from there as well. They're hyperlinks online, so they can then open the papers. And I think that's got to be the starting point. And for many people, that's enough to at least open the dialogue. And if you have a specific concern about a child at the school, that's very important. That takes this to another level. There's one thing complaining or being concerned about general exposures, but actually if a child is having their learning experience interfered with and their health interfered with because you think of exposures at school, that's very important, and the school are accountable. They have to go through a specific process to address that and to discuss your concerns. And so that's kind of the next stage, if that's the setting. If it's just that you're concerned about the exposures, but your child hasn't had any specific symptoms that you think are linked, then it has to be a general discussion about taking a precautionary approach, I guess, is the way to put it. And I'll be honest, I've never liked that term. I've been very open about the fact that, in my opinion, taking measures to lower EMF exposures for children is not at all precautionary. I think it's essential to being responsible medically and socially. But given that this subject is likely to be new to them, I think talking about that as a precautionary approach is reasonable. And then you just have to go down those steps. So where a child is actually ill, if there's still no response, then really the strategy becomes more and more structured, in that you need to write letters, put letters in place to describe what kinds of symptoms the child is having. Make sure that a medical professional is involved. You need to have a doctor involved to assess the child. And again, make sure that they have that same evidence packet available to them. And it's useful if they can ring an expert. So ring somebody who's really familiar with this, to give them even more information and maybe even discuss the specific case of the child. And to take it to the next stage, I mean, I can explain that I've been involved in legal action here, and when really the doors are closed, are fully closed, that is often the only last resort, and it's difficult and it's challenging, but it's essential in some cases to moving forward, and it can be successful. It has been successful. We have had children acknowledged as being disabled purely by EHS. And in that setting, a school then has a duty of care. The local authority has a duty of care to accommodate that child and to ensure that they have access to education the same as other children. It's not easy, but it absolutely can be done.
Right. And how do you evaluate the influence of fire on public policies in the United Kingdom? I'd love for you to also, that's a question that's been posed, to also talk about some of the other legal actions that are happening in the United Kingdom, which are paralleling that in the United States related to 5G and the proliferation of cell antennas, which is happening now.
So I've watched this subject painfully slowly unfold over a decade or so, and it's been fascinating to me how the last 2 years have really escalated this. I think some of the important large-scale animal studies like the NTP and the Ramazzini Institute study really gave a stronger platform for both scientists and medical doctors and general citizens who are politically active to feel like the credible science was moving in one direction, and this triggered a series of events. And certainly I know that here in the UK we have several actions regarding 5G, and that I think mirror some of the actions being taken in the United States and so many other countries now. And these are really well qualified legal teams who have a plethora of excellent barristers who are taking this extremely seriously, and they're coming at it from multifaceted approaches, as well they should be, pointing out health concerns, pointing out ethical and human rights and equalities issues, and all of these things work together. And we're certainly seeing legal wins on individual cases. We're yet to see the outcomes of these large cases, but yeah, I think they're incredibly important. In terms of fire, it's very important to me that we remain an academic body. So we look at this from a scientific perspective, and we use that science to give information to political movements rather than becoming politically involved ourselves. And I think that's that's important for any academic group to maintain objectivity like that. But that's essential. They need to understand the science to move forward. And so we're certainly working in tandem with groups like that to explain the science behind the concerns. Oh, I've lost your...
Sorry, I was muted.
Ah.
So another question that sort of goes on to what you're talking about in terms of schools and action and sort of laying the groundwork in communities. What do you think about having students do surveys about concentration, headaches, attentiveness, itchy skin? And I'm going to add another piece to that question. Or surveys in communities where cell towers have been built and people are getting sick, as is happening certainly in the United States and around the world. What are your thoughts about that?
Mm. This is it's such an obvious and important point, and one that has been entirely missed by governments and health authorities alike. And it's that, given that this is contentious, nobody can say there's no risk. That's an absurd statement. I've heard that said, but it's absurd. Not least because groups like ICNIRP have very clearly designated this in a category where they're accepting that there is an element of risk, and we're waiting for their next assessment to see what kind of classification this will have as a carcinogen. So nobody can make the bold statement that there is no risk. Given that, then when you deploy a biological, something that may cause a biological change, then in order to be reasonable, firstly, of course, there should be consent. When there's no consent, you would hope that they would at least monitor in order to prove that they have in fact not altered health parameters. And this is going to be extremely difficult because of the way that this technology is currently being deployed, in that no baseline control parameters were taken. And even if they had been, there's so much existing technology irradiating that it would still be a confusing place to start. But yes, I mean, should there be something, no matter how humble? Absolutely. I mean, the more that people can do to get some baseline biological objective parameters for health, as well as subjective parameters where they're taking histories and questionnaires and people are explaining whether they've developed symptoms. And you need to be able to then compare that with real exposures. So you need proper measuring. You need to know when antennas have been switched on and switched off and be able to get concrete evidence about that. And then you need measurements in the locations that these people's health is being monitored. And that's very variable. People obviously have a lot of their own exposures, and they have different wall compositions which offer different amounts of shielding. Right. And exposiometers that people can wear on their daily life, that's probably the most honest and fair way of assessing cumulative exposure, is to let people wear those before and after any changes, and then assess objective and subjective health parameters during that same time period.
So someone is asking about dosimeters. I know that we were able to borrow one here in the United States. I think there were only 3 circulating at the time. That was a few years ago. Do you know of any place where one can purchase a dosimeter or like a meter that is continuously tracking your exposure and to what frequencies?
This is a great question, and when you find out the answer, let me know, because okay. I'm actually I'm wanting to know that myself. I think at the moment I wouldn't feel confident to recommend a specific dosimeter or a specific company, but what I can say is it's heavily dependent on what kinds of fields you're wanting to look at, because they're all quite different. Some will be specialized in looking at the higher frequencies, some at the lower frequencies, some at low intensities, some more at broad spectrum and higher intensities. So it very much depends on what your particular study is and what information you're trying to hone in on. And they will all have different specialist areas, very like the meters. You need to choose your meter depending on exactly what you're trying to measure. So you kind of need, before you answer that question, you need a clear hypothesis on what your study design is to show, what you're analyzing. And then you need to do a kind of here in England, we call it a witch review. It's where you look at all the different ones on the market and their strengths and weaknesses, and ideally ask the companies if you might be able to test a product out. That would be even better, to make sure it's not just about good data analysis and gathering, it's also about the ease with which you can translate that into usable data. That can also be obstructive. Sometimes you get so many different parameters, it's really hard to dissect that and use it in a meaningful way. So you need to check that the way the data is captured and then produced is something that you can actually work with.
Right. We really need, it can't come soon enough for there to be consumer grade dosimeters. The one that we borrowed, which was a prototype, as I understand it, was able to show us with a range of radio frequency radiation, what different, you could click it to what different frequencies, downlink or uplink, and see sort of this unbelievable tapestry, or that's too nice of a word really, but the unseen reality of what we are being exposed to in our daily life, and found, for example, that going to the coffee shop had much less, where there's Wi-Fi, had much less radiation than going to school.
Yeah, that does not surprise me at all. I have, just measuring a number of schools now, I found higher levels in classrooms than I found usually any other places at all, which is, it's heart-stopping, isn't it? But I think that's a very common finding. And actually, the release of those kinds of devices, as you say, into the consumer market will actually hugely change the accessibility of simple research projects, which could be very, very important, and give really qualitative, a qualitative look at our environment in exactly that kind of way.
Right. Well, thank you so much for joining us today. I cannot thank you enough. I have put into the chat links to FIRE and a lot of those resources. And when we get this up online, we will make sure to have links as well so that people can access all of these resources you're putting together. And if people want to get in touch with your organization to have talks in other countries, as some people have put in the chat, is there a contact on FIRE that they can?
There is, yeah, they can write a message there, and we can't promise to respond to them all, but I do my best to read through them and get in touch with as many as I can to get back one-to-one where I can.
Thank you so much, Dr. Mallery-Blythe.
Thank you very much.